Hi, everybody. I'm Dalton Miller, president and founder of RetireFlow. So proud to have all of you tuning into this. Wanted to get on and shoot a full training, a full demo, soup to nuts of everything that you need to know about our game-changing service, RetireFlow. A little bit of background on me. I'm from Columbus, Ohio. I went to the Ohio State University. For the agents who are in Michigan, please do not hold that against me, although we're proud to serve many of you. But I come from an agency myself. I started working for my dad's Medicare agency approximately 5 years ago. We have a small LOA shop here in Columbus, just north of Columbus in Dublin. And we got about 7 or 8 writing agents on our team. But my dad's been at it for a long time. So we've grown to serve approximately 23,000 seniors with a Medicare Advantage or Medicare supplement policy. And we're really, really proud to do that. It's a lot of people. But we created a little problem for ourselves. And that problem was all of our clients would call us every annual enrollment period and ask us the exact same question, which is, Joe Namath says there's something better out there. What you got? Or am I still good on the plan that I'm on? And with not a very big team, the call volume grew to be crushing. We could barely survive. We were either going to have to hire a call center or additional payroll to manage that volume. But instead, we developed this product that you're going to see here today. And when we did, we realized that we not only created a very cool retention tool that remediated our issue, but also a very cool new business tool as well. So with that, I'm going to go through a little walkthrough of exactly how our product looks, feels, how it works. I hosted one of these a couple of months ago, but wanted to host a new one that's up to date for all of our brand new features and getting ready for the 2025 annual enrollment period. So we boiled this down to the basics. If you're going to sit in front of somebody, you're a Medicare agent or an ACA agent, and you want to provide someone with plan options, whether they're T65, retiring, already on Medicare. What do you need to know about them? And it's these 5 things. You got to know their prescriptions, their doctors, their hospitals, their pharmacies, and then some key lifestyle preferences. Do they want to pay copays when they go to the doctor? Do they want to retire in Florida? Those kind of things. But these first 4 are very, very sensitive data points. And what we see from agents across the country, and look, I'm not the police, I'm not telling anybody, but they're just exchanging these things in non-secure ways. They're doing it over text or email, or worse, I see some agents buy a bunch of stamps and mail out the letters and expect their clients to mail something back to them. And look, it's 2024. There's got to be a better way. And then, ladies and gentlemen, these folks show up. And I'm very proud of this slide, the way these TV commercials come in all ominously like this. If you're a Medicare agent or anyone who's turned on the TV in the past several years, you know these TV commercials are the worst. I was actually on with an agent in Southern California who told me that my glasses reminded her of Medicare Martha, which hurt my feelings, okay, because Medicare Martha is my #1 arch nemesis in life. But these TV commercials are so patronizing towards seniors, but more importantly, they're misleading. They talk about the shiny benefit, right? To drum up call volume, the same shiny benefits that agents have in the plans that they offer. But Medicare agents, by and large, as good people and good stewards of their clients, know better than to enroll someone in a plan for a free gym membership if the doctor they've been going to for 20 years is now all of a sudden out of network. So we want to develop something that better connects agents with their clients, gets seniors the answers quicker, so nobody calls these people anymore. So what do? We create RetireFlow, and what RetireFlow is at its core is it's a set of online surveys that you can send to your clients and prospects in advance of a meeting. It's going to ask them somewhere between 9 and 13 questions. Again, we have a couple of different surveys that you can purchase from us. The font is humongous. It asks one question at a time. It's incredibly easy for seniors to complete. And when your senior clients complete that survey, you get 3 things. Now, I don't want to sound disparaging when I talk about seniors and the font being big, but agents know as well as I do, if it's not easy, your senior clients just won't do it. So when your beneficiaries complete that survey, you get three things. One, you get a list of that client's drugs, doctors, hospitals, and pharmacies. On those prescriptions, they're spelled correctly every time. Dosage, quantity, frequency, package, brand of the generic, everything you need to go out and run a quote for your client or prospect. The second thing you get, because our survey has been approved through the Health Plan Management System, HPMS, you now have achieved permission to contact. So it works great for your new clients as well. And then lastly, the final question in our survey is that scope of appointment form. And there's a lot of services out there that provide scopes, and that's okay. But the reason that we do it is because let's say you're meeting with Susie next Thursday. You got an appointment on the books. You say, I'm going to call everybody Susie Senior. You're going to hear me talk about Susie Senior some more. So you tell Susie, hey, look, I'm looking forward to our appointment next Thursday. I need you to complete this survey by next Tuesday. That's going to give you a compliant scope, which is great. But more importantly, it's going to give you those drugs, doctors, hospitals, pharmacies at least 2 days in advance. So you can do all of that plan research, show up locked and loaded, quotes in hand. And so to most agents, that just means more one visit closes. And when your beneficiaries and prospects complete this survey, you're immediately notified via email. You log on to RetireFlow and you've got a secure PDF summary of everything you need to know about your clients in order to run quotes and provide them with plan options. So a couple of things I want everybody to be cognizant of how our system works. What you get when you sign up for RetireFlow is a website. In my case, it's retireflow.com/Dalton. That's it. In fact, you get to choose your own website. And what's cool about that is it's short, sweet, to the point. And how you choose to distribute it is totally up to you. You can text it to your clients. You can email it to your clients one at a time, email it to them in bulk in advance of AEP, post it on social media, link it on your website, turn it into a QR code that you can throw up at the end of an educational event. Doesn't matter to us. And wherever your senior clients click on it, phone, their tablet, their iPad, their computer, their Kindle, doesn't matter. We work really, really hard on our mobile versions. So that way, when your senior clients are going through the survey, they're going to feel comfortable sharing some fairly sensitive data with you. But again, it works fantastic on whatever device. And we've integrated Connecture's API tools into our survey. And that's just a long way of saying that when Susie Senior gets to the question, what prescriptions do you take? She types in the letters L-I, Lipitor is going to pop up. Then we're going to add right at the top. Then we're going to ask her, do you really mean that you take the generic atorvastatin? If so, what dosage, quantity, and frequency? So we're going to provide to you incredibly accurate snapshots of Susie's health regimen, oftentimes several days before you've ever met her. Our survey has been approved by CMS via HPMS, the Health Plan Management System, but we're also HIPAA compliant, so you can feel comfortable exchanging this data with your folks. But a couple of fun things about RetireFlow. Our surveys are sticky as all get out. And I say they're sticky because if Susie Senior is going to take the time to answer your 13 questions, or maybe your 9 questions, she's not going to call Joe Namath. She's not going to call the agent down the street. No offense to them. She's going to work with you because your headshot and your logo are going to chase her throughout the survey, saying, hey, I'm your agent, I'm your name, introducing yourself and reminding her, hey, we're only asking these questions to provide you with plan options. So Susie knows, look, if I put good in with my agent, I'm going to get good out. And then it doubles as a liability protection mechanism. And I don't know if this has happened to anybody who's tuning into this. It's happened to me. You meet with Susie and she tells you that she takes atorvastatin and Advair. Those are her 2 prescriptions. You enroll her in a plan, everything's fine. 6 months later, grievance filed against you from her insurance company that says you didn't do a good enough job explaining whether her Eliquis was covered. You think to yourself, Susie never told me she took Eliquis. Our senior clients are forgetful. They can be forgetful sometimes. It happens. Now, with RetireFlow, you've got a time-stamped CMS-approved record of the prescriptions Susie told you she took. So you can send that document in and make that grievance unfounded. So a built-in kind of backup function baked right into our system. And then lastly, I think our greatest feature, the reason why RetireFlow is a new business and retention machine is that Susie Senior or any of your clients or prospects do not have to have a username or a password or a code, none of that stuff to complete the survey. They simply receive the survey from you, they click the link, they answer the questions, they're done. But what this allows you to do is to take our surveys and mass blast them to your clients and prospects in August, September, early October, and collect all those submissions in advance of October 15th. So that way, when AEP rolls around and the busy season gets here, you're locked and loaded with the data that you need, and to provide some color to how many you might expect to get back. We had an agent here in Ohio, where I'm from, send our survey out to 2,000 of his clients last year on September 15th. The email, he sent it via email, and a mass email, maybe a constant contact or something like that. And the email reads, "Hi folks, it's your agent. I'm proud to serve you. If you'd like me to review your plan this fall, please click here, complete the survey." Again, he sends this email on Friday, September 15th at 5 p.m. Over the weekend, the guy does nothing. He watches Ohio State beat Notre Dame. He goes for a walk with his wife. He shows up to his office on Monday morning. He's got 200 submissions on his page from one email 2 days later. That's it. That's 200 people in one weekend that he was able to capture all that good, healthy data. He sent that same email four more times in advance of October 15th. He got 936 submissions before AEP even started. So to that agent, that is 936 people he not have to listen to try to spell levothyroxine over the phone or worry about getting a signed scope. He sent 5 emails, got 936 submissions. So that's what RetireFlow is designed to do, to go out and collect all that good, healthy data in advance of the annual enrollment period. So, and for every single meeting that you take, even outside of AEP. So with that being said, let me give you a live demo of one of our surveys. So that way you know what your beneficiaries are going to be going through this AEP. So I'm going to head over to retireflow.com/Dalton. This is my survey. For those of you at home, if you went to retireflow.com/Dalton, this is what you'd see. Our surveys are white labeled with your logo in the top left, your headshot, your hometown, your state licenses, and links to your social media if you wish. That part's optional. We have an automatic Spanish translator built in. So if any of your beneficiaries happen to speak Spanish or prefer Spanish, all they have to do is click on that little toggle right there. We serve lots of agents in Florida and Arizona and Southern California. And I know this is a big hot button issue that's important to a lot of agents is, not everybody speaks English. As I go through this survey, I want everybody to keep in mind that this survey looks just as good on a phone or a tablet. I would argue it looks better on a phone or a tablet. Our mobile versions are really, really slick. And I bring that up because we just did a study. 65% of the submissions that we process, of the tens of thousands of submissions we process, are taking place on a smartphone. Seniors are getting better at this than they are their computers at home. So again, I'm going to go through this survey like I'm Susie Senior. Hey there, I'm your agent, Dalton Miller. I got some questions for you to provide you with plan options. What's your name? Susie Senior. And our survey is really intuitive, and then it's going to take Susie's name, narrate the survey on your behalf. Hey, Susie, let's get started. We're going to learn about her email, susiesenior@aol.com. Now, folks, all of our questions are optional. So if Susie doesn't have an email, that's okay. She can skip it. And then we're going to ask her for her address. I'm going to type in an address that's close to me. And when she selects her address from that drop-down menu, it's going to auto-populate with her zip and her county. So she doesn't have to type it, but you're still going to capture all that good, healthy data. It's actually going to power some of the searches that we have coming up. We're going to ask her for her phone number, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we're going to learn about her preferred pharmacy. She can add up to 3 pharmacies here. In our pharmacy search, it's going to take that zip, auto-populate it instantly right there. She's going to search for her pharmacy, CVS. What do you know? Here it is, the one closest to her. This is Connecture's API at work. And I bring that up because even your local pharmacies are going to populate here. So she searches for a local Kroger in her area. It's a local pharmacy we have. She can add that there. And again, she can add up to 3 pharmacies. Then we're going to take a look at her current prescriptions. We're going to remind her, hey, go get your prescription bottles. This part's important. We've all met with too many seniors who go, I left my list of drugs at home. Do I need that? You're like, yes, that's why I told you to bring it. Or worse, I've heard from agents that some beneficiaries will bring in a giant bag of pills in advance of a meeting. That doesn't seem safe. So no worries. You don't have to worry about that problem anymore. We also remind Susie that we're not particularly interested in her vitamins or supplements. Thanks, but no thanks. She goes to look for her current prescriptions. Let's say she looks for Lipitor. She types in the first couple letters, pops up right at the top. Then we're going to ask her, do you really mean that you take the generic atorvastatin? Let's say she does. Then she's got a drop-down menu of available dosages. And when she selects that she takes that 40 milligram tablet, we're going to suggest to her a common user quantity and frequency. In this case, that's 30 tablets a month. Maybe she takes 90 every 3 months. She can edit those fields. But let's say Susie takes Ozempic, which is another popular one. Doesn't come 30 pills a month, right? When she selects her dosage, it's going to auto-populate with the package. So you're going to know, oh, this is an injectable, this is an inhaler, something comes in non-traditional means. But lastly, let's say Susie takes Synthroid, another popular one among seniors. But this time, Susie forgets to tell you about her dosage, tries to keep moving through the form. It's going to stop her. Say, hey, Susie, I need this information if I'm going to do a nice job providing you with plan options. So once she adds that dosage, she can now proceed through the survey. All of her information is correct. Then we're going to learn about her doctors and her hospitals. So she lives in Columbus, Ohio. We're going to ask her for a preferred hospital. I bet she goes to the Ohio State University Hospital System. Pretty good hospital system, if I don't say so myself. But again, she can add multiple hospitals here, and every hospital in the United States that accepts Medicare is on this list. So Susie Winters in Florida, she wants to add a hospital down there, she can add it. She's got a grandson in Arizona that she wants to go out and visit for some of the year and go to a hospital there, she can add it. Again, she can add as many hospitals here as she'd like. Then we're going to learn about her doctors. No drop-down menu here. No drop-down menu here. We're going to encourage her. Your headshot says, hey, I need first and last name. That's important. So she sees Gregory House from the TV show and Meredith Grey from Grey's Anatomy as her cardiologist. She can add as many specialists as she'd like. And we're going to give you all that data so that way you can go out and do your own research and have a thoughtful consultative meeting with Susie. And meet with her and you know, identify her doctors and make sure they're covered in her plan. Then your headshot says, hey, here comes the scope. What the heck is it? Kind of a scary, cumbersome thing for seniors, right? They think they're signing their life away. Not our scope. Super easy, clean, highlighted, and glowing, where Susie needs to initial. She initials. I'm going to leave this ancillary one blank, like maybe Susie forgot. She picks a signature that best represents her, and she tries to sign and complete. Uh-oh! I call this the guilt box. We pop this up just to remind Susie, hey, you're not signing your life away here. We're only asking you these questions to provide you with plan options. We noticed she didn't complete the scope. We're going to encourage her to go back and complete it. She can continue on without signing it, and that's okay, but we'll encourage her to go back and complete it. She does, and she signs and completes. She gets this nice screen from you that says your name from your agency will contact you soon. Now, instantly, my phone, as the agent, just buzzed. I got a notification in my email that says, hey, you got a new submission on RetireFlow. Log on to check it out. So I head over to retireflow.com, and I head over to my dashboard in my profile here in the top right corner. It says, welcome, Dalton, or welcome your name. And I head over to my submission center where all of my submissions are stored. And what do you know? Here she is, Susie Senior. You download it, and this is what you get on Susie. Your logo at the top, a perfect secure summary of everything she just shared with you that you need to go out and run quotes for Susie. Her name, address, zip, county, email, phone number, her preferred pharmacies, her prescriptions, dosage, quantity, frequency, package, hospitals, doctors, and then at the end, a signed, dated, initialed, compliant scope, time-stamped with all of Susie's information here. Now note, when we leave this agent section blank, we do that intentionally because, you know, what if Agent Dalton was sick that day and Susie ended up meeting with a different agent? You can always sign our scopes of appointment and our ACA consent forms here in the submission center by pressing sign, and you fill out your portion of the SOA and you press sign right here at the bottom. It will forever modify the document and store that scope for you in perpetuity here in the submission center. I do want to call out a very cool partnership we have with Advanced Diabetes Supply to notify you if your beneficiaries take a drug that might indicate they're diabetic. That's this little gray box here. If you click on it, it takes you straight to the ADS team. No data is automatically shared, but if you'd like to reach out to ADS and say, hey, I saw one of my beneficiaries takes a drug that might indicate they're diabetic, just fill out their little form here and somebody from ADS will call you within the day and maybe help you get that, that prescription for that beneficiary a little bit more affordable and delivered to their home, which is a pretty cool little partnership. You can take action on that if you so choose. But that's what our system is designed to do at its core. You can always export all of our submission data into a CSV or Excel file. So if you've got 50 submissions after AEP and you want to take those and upload them to your CRM or run a report of all of the beneficiaries in your book who take lisinopril, just an example, you can do that here by exporting this into a CSV or Excel file. Now, how much do our surveys cost? Good question. Our surveys cost $49.99 a month. There's a but coming. But for $49.99 a month, each survey, that's how much it costs. You get unlimited sends and unlimited submissions. We do not charge based on the submission quantity. We don't charge based on how many times you send this out. It doesn't matter to us. Get 1 million submissions if you'd like. Utilize RetireFlow as much as you humanly possibly can to prepare compliantly for your meetings. But I said there's a but coming because many of you tuned into this, what feels like 20-minute long training at this point in time. You get promo code RF20, all caps, RF20 for $39.99 a month. You can have any of our surveys, unlimited sends, unlimited submissions. Doesn't matter. That price will not change, will not go up. So for our traditional products, it is $39.99 a month. And folks, if this is something that you'd like to do, if you want to, if you're tired of listening to your beneficiaries try to spell their prescriptions over the phone, or you want to get prepared for your meetings, I know a lot of people out there have a goal as Medicare agents to automate their businesses. RetireFlow is the answer to that. And to get started, to sign up for RetireFlow, it'll literally take you 5 minutes, not even. You go to retireflow.com and you press this big blue Get Started button right there in the center. I'm going to ask you a couple questions about yourself and your agency. You put in that promo code RF20, all caps. It is case sensitive, RF20. And then at the end, I'm going to prompt you to pick a survey you'd like to add with us. What we did today was our Medicare short survey. That's the one that we just went through. We also have our Medicare long survey. Again, all of the questions are summarized underneath. Medicare long is the same survey as Medicare short with just a couple of extra questions, like how familiar are you with Medicare? Tell me about your current health insurance. You on COBRA, you know, those kind of things. If you want MA or SUP, and then we also ask about their retirement benefits, if they like VA or if they have access to VA or TRICARE benefits or a state retiree plan. This is a great survey to have for, especially for your new clients. You can slap it on your website and allow those folks to come in and capture all that data on them, which is pretty cool. We also have our ACA survey. which is designed with entirely different questions. Those survey questions include capturing information on dependents, drugs, doctors, hospitals, and pharmacies on those dependents, smoking status, income level, year of enrollment, and then that one ends with the consent form. And once you've added a survey that you'd like, you select it and you press continue. And then all we need from you is a couple of data points to make your survey. You got to give us your headshot, your logo, your name, your agency name, your state licenses, links to your social media if you want to. And here's a really important part, folks. You choose your unique website. So let's say I wanted to make a survey for retireflow.com/Bob. Somebody beat us to that, but what about Bob Buckeye? You could have retireflow.com/Bob Buckeye if you want. Again, you can customize the URL to as you see fit. And then lastly, you put your work email down here so that way you're notified when you receive a new submission. So I'm going to add an email here, team@dalton@retireflow.com. And then you got to make sure you press add and then save. That's it. You're immediately notified when you receive a new submission, and your page is immediately live. There's no hold time. You can begin immediately distributing this survey to your clients and prospects. And we always recommend go through this survey a couple times, get comfortable with it, test it on yourself, a friend, a spouse, a client that you know first, and then build a plan to distribute this to your book of business. But we're going to give you that link that you can mass distribute out here, right here on retireflow.com. You just copy it, distribute it as you see fit. Again, on our pricing, there's no contract associated with this. You can turn this service on or turn it off as you see fit. We don't really get cancellations. The only cancellations we get is when agents retire, because you got to show up to your meetings prepared, compliant. You know, you can't go into your senior clients' drug cabinets for them. This is a great way to get prepared for every single meeting you take. And folks, if you have additional questions about, I want to make sure this works for me and my agency, how do you integrate with this product or that product? You can always schedule a time with us right here on retireflow.com by pressing set up a demo. This is the best way to reach us. It's a great way to meet with a real life human being about our service. We've got availability as early as tomorrow. So pick a time with us. We'll meet with you one-on-one, answer your pertinent questions, and get you trained up on everything you need to know on RetireFlow. Many of you probably are tuning in to this because you're curious about our integration with Connecture, which is an absolutely deadly combo. That's really a different product that we offer. You must sign up for that through Connecture. We're also, I'm sure that there's another training you might have seen right here on this email that you've opened up, or if you're interested in learning more about our integration with Connecture, we have a full training on our YouTube channel. Just search RetireFlow Connecture. It'll come right up. But with that, so proud to serve each and every one of you. RetireFlow serves thousands of agents around the country. And there's no better way to get prepared for this annual enrollment period. With changes coming from the Inflation Reduction Act, we anticipate shopping up 70, 80, 90%. And if your beneficiaries are going to want to shop, what are the things you need to know about them? It's the things that RetireFlow goes out and collects. So again, so proud to serve you. Go to retireflow.com and press get started, create that survey, get comfortable with it, and then use it for every single meeting you take. With that being said, thanks. Appreciate the time. Go Bucks, and have a great day. Thank you.